Today we're joined by Megan, who is 50 years old and in excellent health. She's got a very busy job and is not particularly interested in any surgical procedures, but she does have some areas of concern.
Things that really bother me would probably be, most of it's all around the area of my eyes.
Your upper face?
Yes, my upper face, the lines around my eyes, I can see some of the, I guess, skin just starting to sag on the upper part of my eyes. In between my eyebrows, there's a lot of wrinkles. And if I move down, I'm losing quite a bit of volume. I feel like just below my cheekbones in here and my lip area too.
Okay. Well, I think you look terrific.
Thank you.
I do see some things that we can help you with. I'm going to start at the right temple. I feel the malar crest, and I see the area that needs to be treated, and I'm also careful to avoid the superficial facial veins that may be there. Once again, the area has been prepped. I generally start in the middle and using a depot technique, deposit the product at the periosteum. I'm avoiding bridging vessels in the frontal branch of the facial nerve. Velour is a newer product. It has a little less viscosity. It's not hydrophilic, which means it won't swell after I give you the injection. This will last about 18 months, frequently longer in the upper face.
Okay.
So what I'm going to do is I'm going to start by identifying where your supraorbital and supratrochlear vessels are, and I'm going to use, again, a depot technique and inject very little product just below your brow. In this location, a little goes a long way, and after the injection is done, I can manipulate the product location. We're addressing the upper lid. I'm cleaning her off with alcohol, and we're using a new syringe and needle, and I'm going to give Megan the same volume on the opposite side. In Megan's case, what I see is a need for some deposited product at the zygoma, at the malar, and the medial cheek. So we're going to put about 0.2 of a cc in each one of those places. I can already see a really nice improvement of the piriform. And again, we've gone back to the voluma because it should give us a very smooth, natural looking, about 2-year result. Megan, the next place we're going to address is your lips. And again, we're going to work from the outside in. So when you put your lipstick on, do you use a gloss on your lips to try and emphasize fullness on your upper or lower lip?
Yes.
So this might allow you to use less of that, because I'll be giving you the fullness that you've been trying to get with the lipstick with the filler.
Okay.
We'll treat the lines around your lip and some of these very fine lines around your cheek with a very thin product called velour.
Okay.
I'm going to take some velour and I'm going to inject it around the corners, and that's going to bring them up subtly. I'm going to inject what's called the white line, which is a connection between your red lip and the cutaneous part of your lip. I'm going to treat the philtrum and give you a little drop right at the center of the philtrum called the tubercle. I'm going to start with a very small amount of product right at the corner of your mouth. And what you'll see is that this will give you a very subtle upturn.
Okay.
I don't want to make your mouth any wider. So I'm going to treat the white line with a very small amount of product. And you can already see a very nice improvement. Go ahead and look in the
Okay.
mirror.
Wow.
With a very small
Oh,
amount of
wow.
product.
Yeah. Wow. It's amazing.
Turn towards me a little bit.
Okay.
So far, turn away from me a little.
Okay.
I've treated with just 0.2 of a cc, a very tiny amount. Your lips look fuller and prettier and healthier, but they certainly do not look too full.
Okay. Oh, wow. Yeah. It's amazing.
Now, I'm going to get a little bit of volume in the central part of your upper lip.
Okay.
And I think that we're about done.